Hi friends, once again welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam, also MHSRB exam and other nursing officer exam preparation. We are discussing questions from Pediatric Nursing. In the previous video we discussed one set of questions and today also we can continue Pediatric Nursing questions. First question, toilet training need to be initiated at the age of options. Option A 15 months, option B 18 months, option C 24th months, option D 20th months. Toilet training should be started at the age of 18 months. Option B is the correct answer. Move on to the next question. A child can withhold and postpone his bowel movement at which age? Options. Option A 1 year, option B 2 years, option C 3 years, option D 4 years. Here the question is, a child can hold his bowel movement or postpone his bowel movement at which age? It is at the age of 2 years. Option B is the correct answer. By 2 years, a child can able to withhold and postpone the bowel movements. Move on to the next question. Which muscle injury causes torticollis during delivery? Options. Option A skeletal muscle. Option B sternocleidomastoid muscle. Option C smooth muscle. Option D cardiac muscle. Torticollis means it's a stiff neck that make the baby is difficult to turn the head or it is painful to turn while moving the head. That is known as torticollis. It is mainly due to injury to sternocleidomastoid muscles. Option B is the correct answer. Move on to the next question. Clum's palsy is due to the involvement of options. Option A 5th and 6th cervical nerve. Option B 7th and 8th cervical nerve. Option C 5th and 6th thoracic nerve. Option D 7th and 8th thoracic nerve. Clum's palsy is due to the involvement of 7th and 8th cervical nerve. Option B is the correct answer. Injury or trauma to C8, cervical 8 to thoracic 1 causes Clum's palsy, in which lower arm, wrist and hands are paralyzed, and trauma or injury to C5 to C6 of brachial plexus cause Erb's palsy. This is also important. Erb's palsy also important question. Injury to C5, cervical 5 to C6. Move on to the next question. Diaper rashes most commonly caused by options. Option A diphtheria, option B E. coli, option B Staphylococcus aureus, option D Streptococcus. And diaper rashes are caused by Staphylococcus aureus. Option C is the correct answer. Move on to the next question. An infant is born precipitously outside the labor room. What should the nurse do first? Option, tie and cut the umbilical cord. Option B, establish an airway for the newborn. Option C, ascertain the condition of the uterine fundus. Option D, arrange transport for the mother and infant, the birthing unit. Our question is, an infant is born quickly or suddenly outside the labor room. Okay, the mother delivered outside the labor room. So, what should the nurse do first? She should establish an airway for the newborn. She should take care of the newborn first. Option B is the correct answer. Then she have to do step by step one procedure, tie and cut the umbilical cord, then change the baby and mother to the unit and all. First she has to clear the airway, do suctioning and take care of the baby first. So establish an airway for the newborn. And move on to the next question. Which of the following is the most common cause of ophthalmic neonatal? Options. Option A Neisseria gonorrhea. Option B Streptococcus. Option C Staphylococcus aureus. Option D Candida albicans. Ophthalmic neonatal is caused by Neisseria gonorrhea. Option A is the correct answer. Move on to the next question. A preterm neonate admitted to the neonatal intensive care nursery has muscles twitching, seizures, cyanosis, abnormal respiration and a short shrill cry. What complication does the nurse suspect? Options. Option A tetany, option B spina bifida, option C hyperkalemia, option D intracranial hemorrhage. Here our question is, a preterm neonate admitted in NICU with the complaints of muscles twitching, seizures, cyanosis, abnormal respiration and short shrill cry. Okay, this is not the signs and symptoms of tetany. Tetany will have this muscle spasm, paresthesia, numbness and all, but not this cyanosis, abnormal respiration, short cell cry and all. And also it is not related to spina bifida or hyperkalemia. It is mainly due to intracranial hemorrhage. Okay, so the correct answer will come option D, intracranial hemorrhage. The baby is having preterm neonate is having muscles twitching, seizures, cyanosis, bluish discoloration of the body, abnormal respiration and short cell cry are the complications of intracranial hemorrhage. Move on to the next question. For what complication should a nurse assess a newborn after a precipitated birth? Options: option A, brachial palsy, option B, dislocated hip, option C, fractured clavicle, option D, intracranial hemorrhage. Here our question is, if precipitated labor occur, precipitated labor means if delivery occurs quickly, then which complication should the nurse assess immediately? She should check the intracranial hemorrhage of the fetus. Why? Because a rapid birth does not give fetal head adequate time for molding. Therefore, pressure against the head is increased and the blood vessels may burst. So, there is a chance of intracranial hemorrhage for the babies. Okay, so here the correct answer is option D. Move on to the next question. A newborn has small whitish pinpoint spot over the nose that are caused by retained sebaceous secretions. When documenting this observation, a nurse identified them as options: option Emilia, option B Lanugo, option C whiteheads, option D Mongolian spot. Our question is, a newborn has small whitish patches and patches or pinpoint spot over the nose, cheeks, which is mainly due to retained sebaceous secretions are called as milia. Option A is the correct answer. And second option, Lanugo. Lanugo is a fine downy hair present on the body, and Mongolian spots are large bluish discoloration mainly seen in back, buttocks or thighs, and it is usually disappears by 4 years of age. And the next question, an infant intestine are sterile at birth, thus lacking the bacteria necessary for the synthesis of options: option A bilirubin, option B bile salt, option C prothrombin, option D intrinsic factor. Here the question is, infant intestines are sterile at birth because they didn't start to feed. Okay, it is intestine is sterile. Thus, the lacking the bacteria necessary for the synthesis of which substance? That is the question. So, the correct answer is prothrombin. Option C is the correct answer. First option bilirubin. Bilirubin is formed by the synthesis of hemoglobin. And second option bile salt which is produced in liver, not in intestine. And last option intrinsic factor. Intrinsic factor is produced by gastric cells, not by bacteria. Okay, here correct answer is option C prothrombin. Move on to the next question. The most common causative agent for diarrhea among children is options: option A adenovirus, option B ribovirus, option C rotavirus, option D rhinovirus. The causative agent for diarrhea among children is rotavirus. Option C is the correct answer. Move on to the next question. Initial nursing assessment of an infant suffering with acute diarrhea and dehydration is options: option A skin turgor, option B low hematocrit, option C bulging fontanelles, option D weight gain. Here the question is, what is the initial nursing assessment or first nursing assessment for an infant with diarrhea is assess the skin turgor. Option A is the correct answer. First we have to check the skin integrity or skin turgor. If dehydration is there or not, then we have to check the fontanelles and all. Weight gain will not come. Weight loss only will come. Okay, so first we have to assess the skin turgor. Move on to the next question. Signs and symptoms of severe diarrhea into a neonate is options: option A vomiting, option B depressed fontanelle, option C abdominal distension, option D yellow urine. Here the question is, in severe diarrhea for a neonate, what is the signs and symptoms we can see? There may be depressed fontanelle. Fontanelles will be depressed in case of severe diarrhea. Option B is the correct answer. Move on to the next question. Pulling out of scalp hair by a children is termed as options: Here the question is pulling out of scalp hair by children is known as trichotillomania. Option A is the correct answer. Move on to the next question. What is the meaning of infant? Options. Option A baby of age group 0 to 28 days. Option B a baby of age group 0 to 3 months. Option C a baby of age group 0 to 7 days. Option D a baby of age group 0 to 1 year. Infancy period means 0 to 1 year. Okay. So here the correct answer is a baby of age group from 0 to 1 year. Option D. Move on to the next question. A neonatal period means. Options. Option A baby of age group 0 to 28 days. Option B a baby of age group 0 to 3 months. Option C a baby of age group 0 to 7 days. And option D a baby of age group 0 to 1 year. In neonatal period means from 0 to 28 days. Infancy means 0 to 1 year. Neonatal means a baby of age group 0 to 28 days. Option A is the correct answer. Move on to the next question. Most common heart abnormality in children is. Options. Option A atrial septal defect. Option B ventricular septal defect. Option C coarctation of aorta. Option D all of this. Which is the most common cardiac abnormality in children? And the correct answer is it is ventricular septal defect. Option B is the correct answer. Move on to the next question. First perception of the baby develops at which age group? Options. Option A birth. Option B 6 months. Option C 3 months. Option D 9 months. Taste perception can occur in the baby at the age of birth. Okay, by birth the baby will get the taste perception. So option A is the correct answer. Move on to the next question and the last question. A child likes to look at self in a mirror at the age of. Options. Option A 1 month. Option B 2 months. Option C 3 months. Option D 6 months. Okay, here the question. At which age group child likes to see himself in a mirror or herself in a mirror? It is at the age of 6 months. Option D is the correct answer. So far we discussed important questions from pediatric nursing. Surely these questions will helpful for your studies. If it is useful for your studies, please share my videos to your friend circle.